And good afternoon. It is Friday, and that means it's time for our regular lunch and learn. Now, today we're going to talk about medical tests. Now, I don't know how you feel about that. I don't know if you're one of the people usually go into one or two groups. You're in the group of, I feel good. I'm not going to have any tests. I don't want to know. I don't want to know if there's anything bad. Or you're in the other group of, oh, I need to have every test because I want to be preventative, I want to be proactive, and all that kind of stuff. So usually people are in one of two camps. I am in the, not that I don't want to know, that's not true. I do want to know. I am not into medical intervention if I can do something holistically. Now, obviously, if I was suffering a heart attack, get me to the nearest ER. If, God forbid, something happened on the road when I'm driving, get me to the ER and do all the necessary things because nothing I'm going to do is going to be able to help with that. However, in everyday life, I'm pretty in touch with my body. I pretty much know what's going on with my body. And so I'm not going to be doing just a whole lot of testing. So I kind of fall into that camp over there. So these are, what we're going to talk about today is the different tests. There's 7 different tests that most of your doctors are going to want you to do. I have not had any of these tests, so I'll take that back. Sometimes I do lifeline screening. You go to one of the local churches or local schools and they do, just different baseline screenings. They do a DEXA scan, but I don't have to take anything internally for them to, figure out what's going on. So these particular tests that we're going to be talking about, I have not done these. And so we're going to talk about this. I'm going to tell you some stories about this. And so we can just move forward. So millions of Americans willingly participate in these tests. There's a high price for these screenings, and the United States spends, I'm trying to remember, $935 million on these screening tests, and yet we rank at the bottom of a 12-country list, which includes your European countries, your Scandinavian countries. We rank at the bottom. And so even though we spend way more money on testing, our health outcomes are abysmal. And so this is something that we need to check and see, do we really need to do this? The United States spends twice as much on healthcare per person as other industrialized nations, all right? But our life expectancy is no better, and our rate of autoimmune disease is one of the highest in the world. So we have to think about what we're doing and why we're doing it. Over-testing, according to Dr. Jerome Greenberg and Dr. Jonas Green, they wrote in the American Journal of Medicine a commentary, and they said over-testing is the root of many of our medical issues. When a test isn't necessary, time can be more appropriately spent counseling patients, listening to them, and redoubling the efforts to win them over to well-developed preventative guidelines. So what does that mean? That means exercise and diet. Most of the time, people come in and they talk to me and they say that they go see their doctor. They're with their doctor 5 minutes. The doctor will say, do this. Here's a prescription. Go get this test. But they don't hear what they're trying to say. And so these 2 doctors are saying, if we quit doing so much testing, we would probably have more time to spend on the patients. So the JAMA review says that we spend the $935 billion wasted money from unnecessary tests and procedure. So these 2 doctors say that the reason we do that here in America is because doctors believe that the test can detect subclinical disease. So subclinical disease means it's not bad enough that you're going to have a symptom, but if they do the testing, they're going to find it. They want to practice defensive medicine. I don't want you to come and sue me for something that I may miss. The doctors lack knowledge or confidence in their abilities, and so we tested you, you didn't test, so therefore we didn't look at that. Or the patient expects it, and there is a profit margin that the practices are asking their doctors. So we do know this, that in practices, the medical professionals are given benchmarks. They need to see so many patients. They need to prescribe so many meds. They need to do so many tests, they need to do so many vaccinations. If you meet those benchmarks, then you're going to get a bonus payment. If you don't meet those benchmarks, then we're going to have a conversation. So there's a lot more driving our for-profit medical system here in the United States than doctor-patient relationships. So I mean, I know that from firsthand. Fortunately, I have not had to go to the doctor, but my poor husband twisted his knee back in August. He heard a pop and he had quite a bit of pain. So he goes down to the urgent care and they look at it and they give him some medication. The medication didn't work, and so he went back and they looked at it again. They gave him some different medication. The medication didn't work. And so, you know, he's very concerned, and he's a little bit older, wanted to make sure that nothing was amiss. And so he's trying to get an MRI. The doctors have said it's a soft tissue injury. It's not a bone injury. So he's trying to get an MRI just to see how bad the damage is, to see what we need to do. And it was like, you know, jumping through hoops in order to get the insurance companies to approve an MRI. Now, do I think that was medically necessary? It was necessary for his peace of mind. He did finally get the MRI. It was a possible tear, so there wasn't anything definitive. And, you know, he lived to see another day, and he's fine now. However, going through all of the shenanigans we had to go through to try and get this approved on the insurance was absolutely amazing. And so going through these tests and doing these tests is not an easy thing. Your doctor, I read a report yesterday that hospitals and doctors are getting really fed up with Medicare Advantage plans because the Medicare Advantage plans are denying the medication, they're denying the testing, they're not paying, they're slow pay. And so some practices are saying, we're not going to take this Medicare Advantage plan, we're not going to take any Medicare patients. And we've known that that's been going on for a long time. So our particular medical system is definitely a for-profit system, and they are not necessarily doing what we need to have done, doctor-patient, you know, communication and what's best for the people. So overscreening is something that people do want. You know, all the time you'll see on the television advertisements for procedures, advertisements for prescriptions and that kind of thing. Ask your doctor, ask your doctor, ask your doctor. So we are geared here in the United States to be patient-driven in our medical care instead of doctor-driven. And so that's a problem too, because it requires us, or it encourages us to ask the doctor for tests that may or might not be necessary. Now, unwarranted tests can cause a lot of anxiety, false alarms, and harmful exposure to different chemicals that they use. So these doctors say that the tests give you a low diagnostic yield. That means they don't really tell you anything, very high cost, and there is an emotional strain of false positives, which are often overlooked when prescribing screening for people who are asymptomatic. Asymptomatic means you don't have any symptoms. And we know, you know, a few years back, we kept getting the message, you may not be symptomatic, but you may have this particular medical condition. Go and get checked out. Go and get checked out. And people were so afraid, so it was driving that kind of cost. So one of the tests that they're talking about is the cardiac stress test. Now, the cardiac stress test is when you get on a treadmill and they either do the incline or they do it where you're running to see what kind of stress that's putting on your heart. Now, what this does is it measures, or it tries to identify if you are headed toward a cardiovascular event. So you can do it on the treadmill, as I said, or sometimes they do it on a stationary bike. I don't know that anybody's done that. However, they measure your heart rate and your blood pressure. Occasionally, doctors want to look deeper and may recommend a nuclear stress test. Now, this happened to my husband. Now, my husband, as I said, he's in his 70s, very, very healthy. Last year, his primary care physician said, I want you to go get just everything tested. So he goes down to the cardiologist and he takes a stress test and he is perfect. There's nothing wrong. And the doctor says, oh, well, I'm not quite sure, there's nothing wrong, so we want to do this nuclear stress test. And my husband said, well, why? And they said, well, because of your age and different things. Now, he's not overweight, he doesn't have a bad diet, he's not a smoker, so there's really no reason to do this except that he's at that age where they do this. And so fortunately for him, his insurance would not approve that they do this nuclear stress test. Fortunately for him, I didn't want him to do the nuclear stress test because A, he's asymptomatic, and B, when they do the nuclear stress test, they put heavy metals in your body to reflect on the imaging, and it is a health concern, and we will kind of talk about the specifics on that. So with the nuclear stress test, they give you a radioactive substance. It is the equivalent of 400 chest x-rays. Now, I've had a chest x-ray. You probably have had a chest x-ray. You know, I've had spinal x-rays before, but I had scoliosis as a child, and so that's just an area of concern that I have. So 400 chest x-rays, 8 million of these tests are performed in the United States every year. But despite their prevalence, the reliabilities of these tests for indicating heart disease is under scrutiny. Experts point out that the stress test mainly detects only significant coronary stenosis and does not identify non-obstructing plaques, which is the common cause of heart attacks. So what that means is you can go in and have this nuclear stress test, and if you don't have any stenosis, which is scarring and hardening of the arteries, if you don't have that, you're going to get a clean bill of health. But you may have that plaquing in there, and if you have that plaquing, this test is not going to show that, so you're going to leave with a false sense of security, and you may have a cardiovascular event. So the plaque is the #1 cause of cardiovascular events. So these tests are very, very misleading. Inaccurate stress tests have considerable consequences. Nearly 3% of participants undergo additional procedures, and 1.7% experience severe reaction to the radioactive dye. So this is something that they're going to say, oh, it's no big deal, everybody does it. But you could be one of those people that has a severe reaction. A study in the Annals of Internal Medicine amplifies this concern, estimating that unnecessary cardiac stress tests, particularly those that involve imaging, cost the United States health system $501 million annually and leads to 500 cancer cases every year. So what does that mean? That means every time you have an x-ray, every time you have an image, you are damaging your cells. A nuclear stress test, cardiac nuclear stress test, 400 chest x-rays. Now, we know also with mammograms, right, it's an x-ray, or they're putting x-rays in to see what's going on. It damages the breast. We do know that the more mammograms you have, the more likely it is that you're going to develop cancer, because the screening damages the tissue. It damages the DNA. Cardiac stress tests are best reserved for symptomatic patients. This means you've got a heartbeat, your heart is hurting, you've got tingling in your arm, you've got high blood pressure, all that kind of thing. So they're best reserved for those kind of people. Recent advice from the American College of Cardiology recommends against routinely using imaging tests to investigate common symptoms such as heart palpitations or feeling faint. Now, I'm just going to tell you women out there, you women of a certain age, if your thyroid is not working properly, and 80% of women have undiagnosed thyroid disease, then your low thyroid function can cause heart palpitations. Just throwing that out there. I'm not medical. I can't diagnose and prescribe. I'm just reading the literature, and that is one of the symptoms that people can have if they have a low thyroid. And so just take that into consideration. When we talked earlier, we were talking about, let me see exactly what the wording was here. What was exactly the wording? Subclinical. Let me tell you what that means. So in your blood work. When you're looking at your blood work, your values are going to be here, and over here to the right, it's going to say normal values. So when a medical doctor gets your blood work, if you are within normal reference range, they're going to say everything is fine. This is why when you go to the doctor and you say, doctor, I don't feel well, and he does your blood work, and he goes, oh, you're fine, your blood work is perfect, go home, it's all in your head. That means what you're dealing with is a subclinical condition, all right? In holistic world, our reference range is much skinnier, it's much narrower. And so you're going to go to the doctor and you're all in good reference range. You're going to bring your blood work to me. We're going to have a lot of red on your paper because you're tending toward disease. So it's a lot easier to bring you back to health before you get into a full-blown disease situation. And so that's what subclinical issues mean. And so I just wanted to kind of point that out because that's really important, because many times people will come in and say, I've gone to the doctor, my blood work is fine. I look at their blood work, I show them their blood work on my screen, and it's red, 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 red. Now, are they in a disease process? No, but they're headed into a disease process. And a lot of times it is just because poor nutrition. The second test we're going to look at is the coronary calcium scan. Now, this scan aims to look at calcium, which is a plaque component in the heart's arteries, which can identify early signs of coronary artery disease. Despite becoming more common, the effectiveness of these scans is being contested. Calcification can suggest a risk of cardiac events, but the test fails to identify the soft or non-calcified plaques, which can rupture and cause heart attacks. Therefore, relying on this test could underestimate your risk of cardio disease. And so we want to make sure that we know it can do this, but it can't do this. So don't walk away with a false sense of security. In his editorial, Dr. John Mandarola and Dr. Andrew Foy wrote, potential harm from coronary artery calcium testing includes radiation exposure, initial findings in up to 40% of scans, misdiagnosis, and then further cost of downstream testing. For patients both high and low risk, the coronary artery calcium score does not offer any meaningful or actionable insights. Basically, it's a waste of time. Don't be spending your money on that, okay? Their final comment is, this particular testing helps the tester more than those that are being tested. So this test is best served in high-risk individuals, those who are experiencing heart symptoms. So if you have no symptoms, then you don't want to be doing this. So CAT scans and MRIs. Diagnostic imaging has proven invaluable in detecting and treating various health conditions early. Yet, in the United States of America, it conducts 245 computerized CT scans and 118 magnetic resonance imaging scans per 1,000 people of the population. That's huge. That surpasses usage in other industrialized nations by 3 to 5%. So we're way over testing here in this country. So it says that the scans are not without drawbacks. The common issue is what experts describe as radiographic incidentalomas. This means they find little bitty things that pose absolutely no risk. But because they see something, they want to go in and do other procedures, take it out, and all that kind of thing. The unexpected abnormalities lead to unnecessary additional tests, treatments, and anxiety for patients. So, CT scans expose patients to radiation, which is equivalent to 70 times a chest x-ray, right? So the nuclear stress test is 400 chest x-rays. CT scan is 70 chest x-rays, potentially contributing to thousands of cancer cases annually. Additional concerns have arisen regarding the trace deposits of these contrast dyes in the scans that cause allergic reaction, and they leave trace deposits in the brain, or they lead to severe neurological problems such as those seen in gadolinium deposition disease. Now, gadolinium is a heavy metal that they put for contrast in your body so they can see what they want to see. If you are at high risk, if you are already dealing with cancer and that kind of thing, that might be a necessary test for you. If you're like me, you have no symptoms whatsoever, then we're going to have more problems with this heavy metal in the body that deposits in the bones, it deposits in the brain, and we can have this forever and ever, amen. You don't just get rid of it. Now, they will tell you at the doctor's office that you get rid of it, but I read all of these reports that are accompanying this report that I'm telling you today. I read all of them yesterday, and they said that there is no evidence that we get rid of the heavy metals. Now, when you come in and you see me and we do the evaluation, we can test for heavy metals. There are certain protocols that we can do to help you get rid of it. But if you don't do anything about it, it gets to stay there forever. Okay? So the frequent reliance on the CT and the MRI scans results in a higher number of false positives. For instance, although 95% of scan recipients may receive abnormal results, less than 2% of these results point to malignant cancer. So 95% of people that do a CT scan are going to get a negative result, an abnormal result. But actually the number is 1.8% of those anomalies are cancerous. So is it really worth putting those heavy metals in your body and then dealing with the cognitive decline and all those kind of things because of the gadolinium? Okay, is it important? Is it worth doing that? You're going to have to decide. I can't decide for you. The American College of Radiology says there is no documented evidence that total body screening is cost efficient or effective at prolonging life. They, along with other experts, alert the public to the risk of unnecessary procedures and stress. So the DEXA scan, which is the bone density scan, all right, it is done all the time. Like I said, I've never had it done in a doctor's office, but I have had it done a couple of times with Lifeline screening. They put something on the heel, I don't know what it is, and they measure and they tell me that I'm all good. So in this particular study, involving 6,150 women, revealed that many osteoporosis drug prescriptions are unnecessary and based on potentially unreliable bone density scans. Notably, 2/3 of these prescriptions were based on scan abnormalities not recognized by international guidelines as definitive proof of osteoporosis, and half of these prescriptions were given to young women with no risk factors. So here we've got another test that's causing these women anxiety, and they're taking these medications, and there's probably nothing wrong with them, and so that's something that we have to look at and see where we are. The scan employs a minimal amount of ionizing radiation, much less than the chest X-ray or CT scan. While generally considered low risk, radiation exposure adds up. Initial findings or unrelated abnormalities picked up in the scan will lead to further cost, further tests, further anxiety for the patient. This is my favorite test that I do not do, the colonoscopy. All right, it is celebrated as an accurate diagnostic tool for detecting colorectal cancer. And it is saying, they say, that it finds the disease early and it is able to get earlier treatment. Most people are advised to begin colon cancer screening at 45 years old. If nothing is found, then they have a next screening at 10 years. Now, a study found that more than 24,000 patients with precise colonoscopy results, nearly half underwent another test within 7 years despite no indication of risk. So what does that mean? That means that our media is really good at manipulating us into being afraid And so we're doing this test. We're not waiting the 10 years like the doctor says. We're doing it 5 years, 7 years, because we are concerned that we're going to get this cancer. Despite their importance in early detection, colonoscopies carry risks, and this is why I don't do them: heavy bleeding, colon tears, diverticulitis, abdominal pain. For those with cardiovascular issues, complications can lead to blood transfusions, surgery, hospitalization, and they can be fatal. Now, my big thing that I'm concerned about is perforation. You perforate the intestine, and then you've got all kinds of issues. In a recent study in the New England Medical Journal said that the perceived benefits of colonoscopies, suggesting that their effectiveness in reducing cancer death may have been overestimated. Less invasive alternatives include the fecal immunochemical test, which detects hidden blood in the stool with 80% accuracy. Similarly, the Cologuard test searches for atypical DNA in blood traces, okay? And those are non-invasive, very easy to do, and they're 80% effective. Now, when I looked at the Cologuard test a few years back, they said if you're over 73, don't even worry about it. So for all of us people that are getting older, don't even worry about it. The sixth test is the PSA, the prostate screening test. Now, I've never had one of those because guess what? I don't have a prostate. However, there's a lot of concern that says that this test may do more harm than good. Nearly 70% of men aged 70 to 80 have some cancer cells in their prostate, although not all cases warrant concern. The American Academy of Family Physicians asserts that PSA screenings frequently identify benign tumors, potentially leading to unnecessary and risky treatment. A concerning trend was highlighted in the Journal of the American Medical Association study. Between 2016 and 2018, 38% of men aged 70 and older received low-value PSA screenings. More than half of these men underwent follow-up services, repeated PSA testings, leading to undue stress, medical procedures, and significant financial costs. So they're rethinking that. For us girls, test number 7 is the pap smear. So I found some statistics very interesting in this. There was a study that revealed 10 million women who had undergone a hysterectomy to have their uterus removed were still doing annual pap smears. Guys, a pap smear, ladies, a pap smear checks the cervix, which is the opening of the uterus, to see if there is any dysplasia there. If you have no uterus, there's nothing for them to check. So 10 million women just don't understand their own biological function, and they're having the pap smear, which is testing for cervical cancer, and they don't even have a cervix. So there's no potential harm from the screening. However, there's nothing to screen, so it's wasted dollars. Why are we doing that? Okay? So the American College of Obstetricians and Gynecologists provides these guidelines. Pap smears are not advised for women under 21, as most cervical abnormalities in this group self-correct, making the test unnecessary and potentially stressful. Similarly, women 65 and older with a 10-year history of negative results do not need to keep doing pap smears. I fall into that category. All right. Women aged 21 to 29 should have a pap smear every 3 years. Now, I know when I was younger, they used to want us to do a pap smear every year, or they wouldn't prescribe birth control and that kind of thing. It was just part of what you did as a fertile woman. But the official guidelines are one every 3 years, or you can do the HPV test every 5 years. All right. So there is a campaign by the Internal Medical Foundation, the American Board of Internal Medicine. It's called Choose Wisely, and you can Google that and you can look at that, and it tells you all these different tests, what are the possible benefits that you would have, what are the possible harms that you can have, and you can choose wisely. It says there are 5 questions you need to ask your doctor. Do I really need this test or procedure? What are the risks? Are there simpler and safer options? And what happens if I don't do these tests? And then the magic question, how much does it cost? All right. In the context of those questions, what will I do with this information becomes vital when considering any test. So for me, and this is for me, not necessarily for you, but this is my perspective. I've never had a colonoscopy. I'm not going to have one for all the reasons I just told you. If I did have a colonoscopy and if they did find something, am I going to go and have surgery? No. Am I going to go and have chemo and radiation? No. So what am I going to do with that information? It's just going to make me nervous. It's going to give me, panic attacks, anxiety, or whatever, because those kind of procedures go against my core values, right? So I have other ways to manage my intestinal health to see that everything is okay. I do thermal imaging. I do all kinds of other things that are non-invasive, because even if I did what they wanted me to do, whatever information that was negative that they gave me that would lead to further interventions, I know I would not do. So that's a real good question to ask yourself. Do I need to spend the money? Do I need to put these harmful radioactive dyes in my body? Do I want to have the false positive and think that I'm all good, but really I'm not good? So there's a lot of questions to ask before we spend money on these tests. And so this is a lot of information. If you feel like you need to have the test, by all means, it's a free country, go and do it. All right. If you fall into the Dr. Polly camp of, I want to do everything holistically, do I really need to do this? I've given you some information. You can look at the Choose Wisely campaign, and you can look at those questions, look at what they say, and then you can talk to your doctor and make the best choices for you. So that was a lot of information today, and so I'm happy to bring that to you. Thank you for liking, thank you for sharing, thank you for commenting, all the things that help us get this out to more people, because we're all about information here. So it's Friday, it is the weekend. We always want you to do self-care on the weekend. Today is December the 1st, so that means we're all gearing up for the holiday season. That might be something that's full of anxiety for you. It could be something that's very, very busy for you. I don't know where you are in this. Sometimes people have family issues. Sometimes people have lost loved ones. Sometimes just life is just not happy, and so the holidays just give more stress. Be kind. You don't know what other people are going through. You don't know the burdens that they're carrying. You don't know what's going on in their private life. It can get really hectic around this time. So take care of yourself and be kind to other people. And I will see you next week.